ADHD is a complex neurobiological condition influenced by various factors. When looking for appropriate videos for your children, consider the content. Top pediatrician and researcher Dr. Dimitri Christakis states that ADHD, also known as attention deficit hyperactivity disorder, does a disservice to children as a diagnosis, and that we've gotten this all wrong. If you have children in your family, then you will want to watch this entire video. The information in this video is not widely known, and it will make a difference in your children's lives. My name is Dr. Andrew Doan. I am a medical doctor with a PhD in neuroscience, and I spent 3 years with the mental health team doing research and training over 2,000 health providers on what I am sharing with you today. I'm going to explore with you Dr. Dimitri Christakis' research and explain with you why I think he is spot on. Let's get started. In 2015, I wrote a research paper on young men who were gaming excessively and sleep deprived because of late night gaming. These gamers developed ADHD symptoms, but they did not have ADHD as children. I will share with you what my medical team discovered at the end of this video. Dr. Dimitri Christakis is a professor of pediatrics at the University of Washington and director of the Center for Child Health, Behavior, and Development at Children's Hospital in Seattle. In a policy statement co-authored by Dr. Christakis and the American Academy of Pediatrics, they recommend avoiding digital media use except for video chatting in children younger than 18 to 24 months and limiting children 2 to 5 years to only 1 hour of quality programming per day. Why do these early experiences matter? At birth, the baby's brain is about 333 grams, and by age 2, the brain triples in size to 999 grams. According to Dr. Christakis, he says that those early experiences are incredibly important. The first 3 years of life are not only important for brain growth, but also for forming the foundational architecture of the mind. Dr. Christakis says, we have to think about the time children are spending with screens. How do we both optimize it and minimize it? How do we make it positive experience? And how do we ensure it's not the dominant experience? It's complicated, which is why we're dedicated to furthering our investigation into this issue. And that's why I'm here on YouTube, because I'm dedicated to this issue as well. Before we break this down further, let's consider some facts. In 2010, the Kaiser Foundation showed that children 8 to 18 are viewing 7 hours, 38 minutes a day of entertainment media. According to the CDC, about 6 million American children have been diagnosed with ADHD. That's nearly 10%, or 1 in 10 American kids have ADHD. Of these children with ADHD, 38 to 81% are receiving medicine treatment, which varies state by state. Of these children with ADHD, 39% to 62% are receiving behavioral treatment, which also varies by state. The economic burden of ADHD treatments is $19.4 billion amongst children and $13.8 billion amongst adolescents. In spite of spending nearly $45 billion per year on ADHD treatments, ADHD rates are up by 30% compared to a decade previous. What are the suspected and known cause of ADHD? ADHD is a complex neurobiological condition influenced by various factors. Here are 8 factors to consider. Factor 1, brain anatomy and function. There's evidence suggesting that ADHD may be linked to lower activity levels in parts of the brain that control attention and activity levels. Their neuronal connections may have been developed in utero or may be induced by the environment. Factor number 2, genetics and hereditary. ADHD often runs in families. A child with ADHD has a 1 in 4 chance of having a parent with ADHD, and it's likely that other close family members, such as siblings, may also have the disorder. Factor number 3, head injuries. Significant head injuries may cause ADHD in some cases. Factor 4, prematurity. Being born prematurely increases the risk of developing ADHD. Factor 5, prenatal exposure. Exposure to alcohol or nicotine from smoking during pregnancy can increase the risk of a child developing ADHD. Factor 6, environmental toxins. Exposure to environmental toxins like lead can contribute to ADHD. This is often found in older buildings with lead-based paints and pipes. Factor 7, parenting and environment. While poor parenting isn't a cause of ADHD, parenting styles and environmental factors can influence children's self-regulating abilities. Inconsistent discipline or neglect may make it harder for children to control impulses or focus attention. Factor 8, screen time. Some studies indicate an association between increased screen time early in life and a heightened risk of ADHD. How do parents use this information? You can't control genetics and what has already happened in utero. However, you can make sure there are no environmental toxins like lead in your home. You can also be consistent in your parenting skills. I think factor 8, screen time, is the major culprit. Compared to screen time, none of the other factors have really changed that much. Digital media exposure has exploded in the last decade. In 2010, the Kaiser Foundation reported that the average American child ages 8 to 18 uses 7 hours, 38 minutes a day of entertainment media daily. What is that doing to our children's brains? Ra and co-authors stated in their research paper, in this longitudinal cohort survey study of adolescents aged 15 and 16 years at baseline and without symptoms of ADHD, there was a significant association between higher frequency of modern digital media use and subsequent symptoms of ADHD over the next 2-year follow-up. More frequent use of digital media may be associated with the development of ADHD symptoms. Furthermore, research is needed to assess whether this association is causal. This study was done on children 15 and 16 years old. Digital media affected their brains and was associated with ADHD. Imagine effects on younger brains. Younger brains are more susceptible, and digital media has a more profound effect on their brains. For example, scary movies elicit a more profound physiological response in young children and less of a response in older children. Let's consider what Dr. Christakis said in his TED Talk.
Which brings us to Baby Einstein. Now, many of you probably have not seen Baby Einstein, but I will show you a random 20-second clip from Baby Einstein Day on the Farm, and here it is.
Well, MacDonald had a farm, E-I-E-I-O, and on his farm he had a cow, E-I-E-I-O, with a here and a there, here, there, everywhere. Well, MacDonald had a farm, E-I-E-I-O.
In that 20-second clip, there were 7 scene changes, about 1 every 3 seconds. It's about the most exhausting day on the farm since John Steinbeck's Grapes of Wrath. And of course, it's nothing like being on a real farm, right? Adults watching this find it discombobulating because your mind is trying to make a coherent narrative out of this, and there is no coherent narrative. It jumps all over the place. But babies aren't trying to make a coherent narrative out of it. They're not capable of doing that. It's all of that screen change, all of that stimulation that's keeping them actually engaged in the screen.
The fast-changing scenes in the videos and games will train the brain to search quickly for information. For example, gaming is a very fast form of interactive media. Simulators, which are similar to games, have been used to train surgeons, law enforcement, military, and pilots. Research has shown that digital media simulators are effective training tools and therefore train the brain. A child who's watching a video that changes scenes every 3 to 4 seconds or playing a game with numerous visual stimuli to track is training their brain to improve seeking, tracking, and acquisition of new information. Unfortunately, in real life, such as in a classroom, seeking, tracking, and acquiring new information every 3 to 4 seconds is not desirable. The American Academy of Pediatrics recommends no screen time for kids 18 months or younger, unless it's video chatting with an adult that they know, like a parent or grandparent. I recommend delaying screen time for children for as long as possible. For children 2 to 5, limit non-educational screen time to 1 hour per weekday and 2 hours per weekend day. For ages 6 and older, limit screen time to less than 1 to 2 hours per weekday and 2 to 3 hours on weekend days. Content matters. Consider this opening sequence of Mr. Rogers.
It's a beautiful day in this neighborhood, a beautiful day for a neighbor. Would you be mine? Could you be mine? It's a neighborly day in this beauty wood, a neighborly day for beauty. Would you be mine? Could you be mine? I have always wanted to have a neighbor just like you. I've always wanted to live in a neighborhood with you. So let's make the most of this beautiful day. Since we're together, we might as well say, would you be mine? Could you be mine? Won't you be my neighbor? Won't you please? Won't you please? Please won't you be my neighbor?
The opening scene takes 1 minute, 10 seconds. The video is slow, scrolls, and without scene changes, demands the brain to maintain focus without frequent changes in scenes and visual stimuli suddenly appearing on the screen. These types of videos are excellent for young children above 2 years of age. Let's consider an episode from The Little House on the Prairie.
And as for your teeth and eating candy, you wait and see, Nellie and Willie are going to have bad ones in a few years. You fetch some water for the dishes.
Yes, Pa. I told Nellie her teeth would fall out. She didn't care. She'd just buy teeth like her mother has.
I didn't know Mrs. Wilson had store-bought teeth.
Well, how could you tell? She never smiles.
The scene changes at 7 seconds and then at 12 seconds. Media like this is excellent for a child with family-friendly content that consists of slow scene changes. The slow scene changes slows down the mind and the brain. When looking for appropriate videos for your children, consider the content. Common Sense Media is a good place to start to consider family-friendly recommendations. Then use a stopwatch to time the scene changes. Avoid shows that are changing scenes every 3 to 5 seconds. The slower the scene changes, the better. So how about adults? In a mental health clinic, Dr. Eickhoff, a nurse practitioner who was working with me, noticed a lot of her male patients in their 20s complaining of ADHD symptoms. These young men did not have ADHD as children. Nearly all of them were gamers who were playing more than 40 hours per week and not sleeping because they were gaming in the middle of the night. We found that sleep deprivation associated with excessive gaming resulted in symptoms consistent with ADHD. These men had inattention, hyperactivity, impulsivity, and poor sleep due to gaming. They were asked not to game and get some sleep. With rest, their ADHD symptoms resolved without medication. Getting adequate quality sleep nightly is so important. If you want to try unplugging your child to see how their behavior changes, then I recommend a digital detox. Dr. Victoria Dunkley is a pediatric psychiatrist, and in her book, Reset Your Child's Brain, she recommends an abrupt 3-week fast. In her psychiatry practice, she sees anxiety, depression, behavioral problems, and mood disorders diminish significantly in just 4 weeks. Dr. Nicholas Kardaris recommends a gradual tapering off of media followed by a 4-week detox in an effort to avoid explosive episodes that are often associated and triggered when addicts are abruptly starting detox. I think if you have a young child, an abrupt fast is easiest. However, if the child is older and near adolescence, then gradual tapering is safer. I publish steps to guide your family through a digital detox in a separate video. The link to to that video is in the description below. I am interested in your questions and comments in regards to ADHD. If you have had success with your child by removing media, then please share your experiences below for the benefits of others in the comments. Help me spread this important message, and to receive additional health tips, please like, subscribe, and turn on notifications. Until next time, I wish you health and joy. Thank you.